Hi everyone. Have you ever asked why is it very difficult to interpret an ECG? Here is the answer. You need to know the basics of ECG, then only it will make it easy to interpret the ECG. And what are the techniques? There are no techniques other than learning the basics and reading an ECG every time. Today here we'll see how can you learn the basics easily. So let's get into the content. So before that, what is the concept of ECG? It is not a tool for diagnosis, but it is a supporting tool for your diagnosis. Having said that, your major part of assessment and diagnosis will be your history and physical examination of the patient. Now often when you say about ECG, what comes into your mind? Obviously the PQRST wave, and in this picture you can see an additional U wave. What is it? So we'll see the components of ECG. So P wave is the contraction of atria. QRS is the depolarization of the ventricle. Since the ventricle muscle mass is more, it is having the peak. T wave is the repolarization of ventricle, and U wave is nothing but the repolarization of papillary muscles. Now, before reading an ECG, it is very important to know the times and speeds of an ECG. So, ECG runs at a standard rate of 25 mm per second. Each large square represents 0.2 second and each small square represents 0.04 seconds. That is the basics of your ECG from which you are interpreting the ECG. Now we need to know the heart rate calculation, the first thing which you are learning from an ECG. So where you have to exactly look for the ECG heart rate interpretation. So here comes the RR interval. So what is it? So as the picture clearly shows, you can see the the distance between two R, the two QRS complex is called as RR interval. So whatever we are going to talk now is having a base of RR interval, and we need to look into the heart rate between 2R. So here comes the first method. So what you're seeing in the picture. So the first large line next to your first R is 300 beats per minute. Next coming large line is 150 beats per minute. Next coming is 100 beats per minute. Next is 75 beats per minute. Next line is 60 beats per minute, and next line is 50 beats per minute, and it goes on. So starting from the nearest large line of your QRS complex will give you a mere idea of heart rate, which is not very accurate or precise if you want to say. What are the other methods? The second method also is little bit complicated, where you will have to look into the RR interval and calculate the number of small squares, and then you do a calculation of 1500 divided by number of small squares, so you will get the answer. Now what is the third method? So this is somewhat easy method where you have a calculation of 300 divided by number of large squares, which will give you the heart rate in beats per minute.